I am Opeyemi Adebambo. I'll be your anchor for today alongside Chief Nursing Officer Mrs. Olubodi Adiola, who is well seated with us in the studio this morning. Good morning this morning, and thank you for joining us.
Good morning.
It's good to have you in the studio this morning.
Thank you so much.
So, for the benefit of Lagosians and listeners out there listening to us at this time, I would like for you to, properly do an introduction of who our Chief Nursing Officer is and your portfolio with General Hospital Ikorodu.
Thank you, my brother, the coordinator of the program. I want to appreciate this the management of this IKD Ikorodu for this program, for partnering with the hospital. I'm Chief Nursing Officer Olubodi Adiola, a midwife, a nurse, and a pediatric nurse. And I also have my Bachelor of Nursing Science in Nursing Science. And I work in pediatric department in General Hospital Ikorodu, especially the neonates ward, where we call NICU, Neonates Intensive Care Units.
Thank you very much, Mrs. Olubodi. I like the fact that looking through your profile before we began this program, I see that you're well grounded within the medical space. Now, this is to say that not once, not twice, on several occasions, you have been opportune to be in that room where mothers, put to bed safely. Let's start with this conversation when we talk about neonatal jaundice. What does this mean in its layman terms? For the benefit of the laymen outside there listening, how best can you help us understand the topic for discussion today?
Thank you so much.
Yes, please.
Neonatal jaundice can be defined as the yellowish discoloration of the eye, that is the white part of the eye, which we call sclera, of a newborn baby and the skin of the baby. And it's due to hyperbilirubinemia, that is increase in the level of bilirubin in the blood of a newborn. And it affects in Nigeria, I think all over, it affects 60% of a term baby, while 80% of a preterm baby.
60%
of a term baby and 80% of a preterm babies.
Wow.
So it's something that is very common, even everywhere. And we have
Yes, you can go ahead.
We have two types of this jaundice.
No, before we talk about the types,
Okay. So let me expatiate on that definition, because you were saying
the names are heavy.
The hyperbilirubinemia means that increase in the level of bilirubin in the blood of that baby. What is the cause? What does it mean? When babies are in utero, they have a lot of hemoglobin, which they use for their gaseous exchange and a lot of things. But when they now come alive, they want to adapt to the extrauterine life. That is the life that we live here. So the bilirubin, the hemoglobin tends to break down. So as they are breaking down, there will be increase in the breakdown, and their liver is not yet mature to carry all this. So that is why it will be so high in the blood, causing neonatal jaundice.
Yes. Thank you for that one. If you're listening at home, I would urge you to stay with us all through this conversation, because with the way our Chief Nursing Officer started this conversation, I can tell you that we will learn a lot right from this conversation. You've done well to help us understand this, and the fearful part is the fact where you said 60% out of 10 children would witness these yellow eyes. Right? But then I want to believe that there is nothing to fear. There is nothing to worry about, which will bring me to my next question. Let's talk about some myths or some assumptions around these yellow eyes, which is also called the neonatal jaundice. I prefer using the yellow eyes more often because people around can easily relate with that. For you, what are some of the myths, that you think people have assumptions with? I will tell you one, and then maybe you take it up from there. We hear a lot of times that when a baby has yellowish eyes, take the baby outside the early morning sun, spread the baby outside like a cloth that has been washed, and allow the early morning sun to help the child recover from these yellow eyes. Is this medically proven true, or this is just another myth or fallacy of the assumptions of people?
We can't say it's really true.
Okay.
Because why people say that is because what we used to treat this, like I wanted to talk about the type the other time. If we talk about the type, we have the physiological type, we have the pathological type. The physiological type will happen after 2 to 3 days of life you will see that yellowness of the eye
Mm.
of that baby. Start from the eye or the skin of at the face of the baby.
Mm.
So when you see that after 2 to 3 days, that's likely physiological. So
Okay.
people knows that we use phototherapy lights. That's the treatment management. So that's why they believe if we put in a sun, early morning sun, blah, 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 it can help. That physiological type will go on its own. But how are you so sure this is physiological if you do not come to the hospital? So I think our advice and why we are here this morning
Exactly.
is to advocate that everybody, once you notice that, please come to the hospital. Because some of them, before 24 hours, you will see that yellowness of the eye. That's the pathological part. Now, I just told you that we have two types.
Yes.
Yes. That's the pathological, that it might be due to any disease condition that is apart from normal breaking down that I've explained to you. It might be due to that. So you don't know which one, except you come to the hospital and we run some tests on that baby and be able to be sure. If it is the physiological, the one we can think, oh, go. Those are the ones they put under sun. Whether they put under sun
or not.
Yes, it's physiological, it can go. But come to the hospital, let us know the level. Because we have various ways by which we measure it. At times, that physiological, it will not grow more than 5 milligram per GL in a day. Whereas the pathological, in a day, you are having more increase when you do the test, more than 5 milligram per GL. So that is it about that. Well, you said I should say another myth.
Yes. You can put us through, because that is the only one I think is very common.
Yes, a lot of people believe, once it's out like that, let's give pawpaw water, unripe pawpaw water, which I just saw last week. We are seeing this one so much. A lot of times, babies are not supposed to die through jaundice. Like you have that, because 60% of babies, that shows babies are not supposed to die. Babies are not supposed to have complications.
Is this to say baby dies? Baby, they die because of this?
Yes, we'll get there.
Wow.
Because we have complications of neonatal jaundice when it is left untreated. So these babies are not supposed to die due to neonatal jaundice if it is well attended to. So, like I said, some people will give unripe pawpaw water. Some people will give onion water. It was last week I saw somebody giving onion water. And unfortunately, we lost that baby because they have done that and these jaundice have entered the brain. This bilirubin that we are talking about is supposed to go through the liver and to the intestine, and babies excrete them when we treat them with that phototherapy light or any other thing we want to do. If it is too much, we do exchange blood transfusion to make sure it does not get to the brain, of the baby. So if baby cannot excrete it, it's too much in the blood, and blood flows throughout the body.
True.
So through that, it can cross and get to the brain. Whereas baby now comes, baby that just supposed to come and you will see the yellowness of the skin and we'll say, okay, let's do the level. Let's put this baby under phototherapy. Let's observe some things. By the time they will now come, people would have started having this abnormal movement of the upper limbs and the
baby is no longer comfortable.
Cyclic movements. And baby would have stopped feeding or reduced feeding. Or when they feed, it tends to be like aspirate the feed because it's affecting them in the brain already. A lot of things have happened. They will now be sleeping, difficult to rouse. They don't want to wake up. The yellowness will be so much that it will now, everybody will be able to see. It will now be so pronounced. So people believe if we give pawpaw water, it will go. No, it will not go. People believe if we give onion water, it will go. No, it will not go. Those are the things. People believe if I give Ampiclox Bicham, that drop, a woman told me that that 7 days drug that we used to use in those days. That's not the treatment for jaundice. When we use antibiotics in the hospital is when this baby already has sepsis now with the jaundice. That's when we treat with antibiotics, not for the jaundice. Treatment for the jaundice is the lights. Phototherapy light is a special blue light that we put on the baby. Will cover the face, cover the pubic area, the private parts. We'll remove the clothing and put the baby under lights. And if it is the one that light will not work for, that's when I talked about the exchange blood transfusion. There are a lot of causes I don't think I don't know.
Yes,
if
we'll still get
go
to
there.
yes, we'll get to the courses.
So I think
we'll get to the courses. Thank you. Thank you for that one. You are from the pediatric department,
Yes.
and with your wealth of medical experience, I know you should be able to tell us, this next question, the answer to this question. At what age can we say that a child, a baby, is free from neonatal jaundice? At what stage is it? When it gets to the age of 1 or 2, or is something that it could be any time as a baby?
Thank you, my program coordinator.
Yes, ma'am.
So the like I said, that the physiological jaundice, we will observe it from second day upward, like between second and third day. That one gets to the maximum by 5th day, and by 1 week it will clear off. So physiological jaundice in a term baby, a baby that is term, that has the term normal pregnancy period,
Yes,
will clear off at the end of a week. So that's when the baby is, yes. And the preterm baby, if baby is not that term, so if it's in the hospital and we are able to treat the baby well, it will clear off within 2 weeks.
Within 2 weeks?
Within 2 weeks.
Brilliant.
Except the ones that we call pathological jaundice. The one that I said maybe due to some disease, like it's not really disease, like we call it ABO incompatibility.
Which might lead to the blood
group of the
transfusion.
mother and the baby, that's
okay.
the cause, or that liver. Those are the ones that can go beyond that 2 weeks. Or then by the time we will treat and everything, it should clear off within over 2 weeks to a month.
2 weeks to a month, maximum a month.
Yes, if baby is treated in the
properly.
Hospital, yes, properly.
Not self-medication.
Not self-medication.
Thank you. Like, I want to ask this very simple but yet a bogus question, and it's as simple as asking, how bad can neonatal jaundice be to a child? The reason for my question is this: some persons will tell you that, in our family, it has happened before to Yalagbaja. In fact, it happened to you when you were small. Don't be scared. Don't worry, it will go by itself. For the benefit of those listening, so that they will know how dangerous or terrible this is, how bad can this be?
Like I said the other time while I was divining the physiological, the type, everything depends on the type. Those people that are saying, don't mind them, it will go on its own. Maybe that baby has a physiological jaundice that time.
Okay.
Like I told you that one, once it's physiological, it will go on its own. But an individual do not know this is physiological until you come to the hospital and they check that test.
We have some mothers that are experiencing this for the first time. This is like their first born. I don't know. I forgot what they call it. I think my first womb opener or so. There's a way they call it. So some of these things might be strange to them. This will bring me to the symptoms of neurotic jaundice. What are some of these jaundice symptoms that people will see, or mothers will see, parents will see, grandparents will see, and they should be able to say, this is jaundice, hospital, yeah. What are some of the symptoms?
Thank you.
Yes, ma'am.
The first thing most of the time is that yellowish discoloration of the eye.
Okay.
The sclera, this our white part, supposed to be white in a child. So when you see, I just call it tinge now. A child that you gave birth to, though it's just a day, but now with this information now, everybody is supposed to continue to be aware and monitor your baby. So like you give birth to a baby, and the second day you observe that this eyeball, this white thing is not like as white as yesterday. So please go to the hospital or get to your healthcare provider and say, help me check. That's the first thing they are going to see. A tinge is not that it's going to be yellow like that. You don't have to wait till it will be yellow. By that time, it has spread to the face, it has spread to the upper chest, lower abdomen, the legs, the limbs. It do spread all over. But it will start from that. Mother will recognize that, this eye is not like yesterday. So you will see it. After that, maybe by evening, you see that the face has changed again. The face will look yellowish, as in the skin.
The skin?
Yes. You will, if you are be observant. So this is not an era of you get birth and they say, close the window, close off the lights, put the baby under clothes. Don't let anybody see. You have to observe your baby often. Observe your baby. When you deliver, observe everything. It's your baby. So when you are observant, you will check it and you will see it. And that one I said is the yellowish of the
skin,
eye,
yes.
of the skin. So that one is even enough. We don't have to wait till That
Any other
another
symptom?
sign is when baby refuse to eat. When baby is difficult to wake. Baby does not want to wake and eat. Difficult to sleepiness, increase in the sleeping pattern of the baby. You don't have to wait till that time. Before waiting till baby will start having cyclic movement of the upper hand and the lower, those times is getting bad. The thing we're supposed to see is that tinge of the eye. Please come. Let them check that level. If it is still okay, you will be asked to just come in another 2 days and we'll keep on monitoring. Then in the hospital, we'll collect your history. Because the causes, like I said, ABO, some babies is due to the blood group of the mother. So if you deliver in the hospital, we already envisage that baby is likely to have it.
Okay.
So even those baby, we will still tell them not to go home if you give birth in the hospital. So we emphasize that it's likely this baby will have neonatal jaundice because there is this antibody antigen a reaction in the body of the baby already. Like people believe that mother of blood group O. I don't just want us to go to.
Is this to say that neonatal jaundice could be a genetic? It could be.
It's not genetic.
Oh, okay.
It's not. We call it ABO incompatibility.
Oh, okay.
That is when the blood group of the mother and the baby. You know, baby pass through the mother.
Yes, sir.
And the blood can pass through the placenta. So when there is a little incompatibility, we have got some people O resource negative mother.
Yeah.
So a lot of things are into that. So when it happens like that, we emphasize that this baby is likely to have jaundice. So those ones, we ask them to stay and we will monitor duly in the hospital so that we prevent any complication.
Thank you very much. 0904-081-1061 or 0904-082-1061 will be the studio lines where you can call us and talk to us as regards our conversation for today. Our medical practitioner in the studio will do well to answer these questions. Now, let's talk about the mothers now. For the fact that you are saying that maybe because of compatibility and all, is this to say that there are some things these mothers are doing while they are pregnant that is bringing about this jaundice? Are there some causes that, it is during the time of pregnancy, maybe you were drinking, you were taking too much sugar, you were going to parties? The mothers, do they have a role to play with this so-called jaundice?
Most of the time, no.
Okay.
Like I said, that ABO, all the bloods in our body, God created us. So it's nobody's fault that I'm O positive and I got married to A positive father or my baby takes B. Do you understand? So it's not my fault. It's not what a mother should bother about. Apart from the resource negative I said. If a resource negative mother gets married to a resource positive father, negative is like, negative has antibody, so positive has antigen. Antibody want to fight the antigen. So thereby may affect the baby even in utero. So, and there is an injection that the mother will be asked to get after, that one will take care of the baby and make the baby, we'll be able to have our baby. But with that history that, you are O negative mother, we have to say that fighting of antigen and antibody.
The tendencies are there already.
So the jaundice is not like a disease that is very like that. It's just a condition to babies. So if it is well and properly treated, there is no cause for alarm.
Before we talk about treatment now, I want to believe it's okay to talk about preventive measures. If at all, there are preventive measures. But if not, yes, please. Are there preventive measures like the way you medical practitioners will always say, pregnant woman, don't eat this, don't eat that. If you have diabetes, don't do this, don't do that. Are there some preventive measures, things not to do to ensure that your child do not have to battle with jaundice? Are there any preventive measures at all?
We just used to talk about early feeding. Once that baby is 10 and is mature and there is no disease condition, so we need, and it's not a premature baby, we used to talk about early feeding. Like I said, that the bilirubin, the level is high. So it's breaking, the liver is trying to break it down and pass it to where it will be excreted. Digestion process, we need fluid.
True.
We must not be dehydrated.
Yes.
So if baby feeds well and baby is not dehydrated, definitely it can help to prevent jaundice in a physiological type of jaundice. So when you feed your baby well, baby pass excreta, baby wee, is this bilirubin, you know that if you check our poo, elements of bilirubin is there in the poo. So baby poo it out, baby wee it, so it reduces it in the body and in the blood of the baby. So I think early feeding and feeding well can help to prevent this.
All mothers out there, breastfeeding mothers, newborn babies, ensure that you feed them early. This is very, very germane, as well as this is key. You've heard that from our very own guest, Chief Nursing Officer from General Hospital, Ikorodu. Now, let's talk about, one of the reasons why you're here, Ma, is to orientate the public and help them know. Maybe let's take this call before we go ahead. Hello to you, good morning. Thank you for calling this morning. Thank you for calling.
Food malnutrition is the major causes of 80% eyes problem in this house. And this kind of eyes problem can only be discovered in a developing poorest nation like Nigeria. Among other victims of economic injustice. Are you getting my point? It's untreatable. Supposedly it's treatable. With all my efforts in 30 years, I have some solution to it. Even with the assistance of some optimists, we lack solution to it. So because of that, is why I used to resist against any form of economic imbalance. So that we will not be able to be destroyed while we are still alive. They said to Yoruba that Oju that Yara, and Oju Nyobara. In that regard, eyes is the king of the body. In that regard, we don't need to tolerate any form of economic injustice that will cause poor economic inefficiency. All this kind of fun, my brother, God bless me.
All right, of course, it's still the issues on IKD 106.1 FM. And today we're talking about jaundice that affects babies, newborn babies majorly. And our caller there, Mr. Isa Mustafa, is speaking generally, I want to believe, speaking generally about the eyes and how important the eyes is. Yes, we of course want to agree with that. Moving ahead with our conversation this morning. Now, let us talk about one of the reasons, the major reasons why you are here, right? Which is the causes. You briefly mentioned earlier, but now I want us to go into details for the benefit of those that are listening. What are the causes of jaundice?
Yes, causes of jaundice. We have, like I said, that we have increased breakdown of red blood cells. It's the increased breakdown of red blood cells that allows the bilirubin to be available in the blood. That's what will cause the yellowness of the skin and of the eye. And the second thing is immature, because the liver of a newborn is not yet mature like that of the adult. So as the red blood cells is breaking down, the liver could not, most of the time, could not really, this thing comes in unconjugated, like fat soluble. So we want to turn it into a water soluble so that baby could pass it out. So when the liver could not do the work as it's supposed to, and it's not due to anything most of the time, it's due to the cause that they are still small. They are the newborns. The liver is not yet mature. So they could not excrete everything. So it will cause jaundice. That's about the physiological jaundice. So when we're not talking about the pathological,
which is the second type of jaundice.
Second type. Most of the time, some babies might have liver disease or liver issue. Like all this, it might be a congenital. There is anything can come from in utero during development. So some of them might have liver atresia. That is even biliary atresia. That is, there is a part where this thing supposed to pass through. There may be narrowing. So if that thing could not pass through,
no free flow
for it to be excreted, it will stay on the blood. Those ones are the ones that will give special care and can even cause so many investigation and treatments. And this one I'm talking about, ABO, is also a cause. That is ABO incompatibility. That I said that maybe an O positive mother, if you give birth to A or B, the antibody antigen fighting themselves might cause it that the bilirubin level will be high, because it will stimulate the antibody production of antibody will affect it. And another one is some babies that maybe they use forceps during delivery, or there is prolonged delivery. So that they do have this what we call Kefa hematoma. You know, some babies, when they give birth to them, you can see the caput, the back of the head, that is oblong. You will see that it's through the birth canal. Through the birth canal, and it will be oblong like that. So during that time, it is the blood that will spread to that place. Kefa hematoma, that is accumulation of blood, in that on the head. So this blood that's accumulated, after some days, it wants to go down because that thing it will go down on its own. So as it's going down, is the red blood cells that is breaking too. So as it's breaking down, it's causing jaundice for baby too. So those ones can also cause it. So those are the causes of jaundice.
Thank you very much. No doubt we can tell that you sure know your onions well and you're grounded with what you do. Now, let's talk about the treatment process now. You know, many a times I always like to know these things, you know, when you talk about a particular form of illness or disease or whatsoever the case may be, people will tell you, I don't go to hospitals because they are expensive. Oh, I don't go to hospital because of the stress of rudiments of procedures and all that. When we say treatment for jaundice, how is the treatment like? It's a 2-in-1 question. Put us through a detailed way of how the treatment looks like. Some people will tell you, I don't even want them to treat my child jaundice because they will carry the child, put inside one machine. And the fear is already there. What's the process like? Let people at home have this idea of how you treat jaundice. And at the same time, the second question, which is a 2-in-1, how affordable is it? For somebody hearing you now, and they want to come to General Hospital, there's a newborn baby, they are looking at the eyes, it's looking as if there are yellowish signs there. How affordable is it? Is it something that Yoruba will call berry, that they will need maybe 100, 200, 300, without mentioning figures anyway? How affordable is the treatment of jaundice?
Thank you so much.
Yes, ma'am.
Treatment of jaundice, like I said, that we do put this baby, and like I first said, that when these babies come to the hospital, like you said, a mother that is looking and is afraid, say berry, is not all babies that we even put under light, like I said the other time. You might even come, we will check the level. Once they check the serum bilirubin, they will check the level that baby is. They might ask the baby, go home, come 2 days time.
Okay.
And we'll still check. And as God will have it, if it is physiological jaundice, by the time baby comes, it may come down or stay at the level through in which we know that there is no problem. We will still ask the baby to go and come back, and we'll check with this machine. So we have machine, we can do that serum bilirubin. That one, the blood will be taken. A little quantity of blood will be taken and sent to lab, and it is the laboratory that will run that test. There's another one that they do with, we call it TCB, transcutaneous bilirubinometer. It's something that will read it on the skin. So we'll put it on the skin of the baby. That will also help us. But we can use that for a baby after 35 weeks of life to check, like after the one that developed after second day.
Okay.
Like when bilirubin level is still between, like under 15, we'll like put under that light. It has a range. But when it's getting to 25, that one we have to do exchange blood transfusion. Because we don't want complications. We don't want this thing to get to the brain of the baby. So that is when we'll get a blood. Because you said I should try and explain. We know what to do in the hospital, but we'll try and remove blood from baby and put, the exchanges. It's not like we'll draw all the baby's blood, so that mother will not say they will draw all my baby's blood.
And
I'm not coming. No.
Thank you, Chief. Thank you, Chief Olugbodi. We have just 3 more questions, but I would, of course, say thank you so very much for enlightening us. It's been very, very educative, at the same time entertaining. Your energy is very admirable. 3 questions before we leave, and the next will be, with all sincerity, without you being biased, for the fact that you work with General Hospital or you're a medical practitioner, it's fine. Should it be all cases when parents, mothers, see these signs and symptoms of jaundice? Should it be all cases they need to come down to the hospital? Now, this is what I mean. Are there no medications? We know of some illnesses where they will say, oh, buy this one and buy this one, give the child, buy this one and buy this one, rub on the child's body, the illness will go. When it is jaundice, do parents, mothers have to come to the hospital?
Yes.
There are
Yes.
no medications.
There are no medications.
It only has to be done in the
Yes,
hospital.
that's why I said some people will say antibiotics. Antibiotics, like I said, when you asked me for treatment, I said it's phototherapy light and some other things we do. Because I said because you do not know the type that your baby has. That's why it's good for you to come to the hospital. Let people that knows this way, let them help you check. You know, you carry this pregnancy for 9 months. You can't afford to let anything happen to the baby. Even myself, being a nurse, I went to somebody last month, she delivered, and I observed that yellowness, and I said, oh, go to the hospital. Despite the fact that I work there. I won't say, oh, I can say this is no more than 6, don't bother to go. I'm not supposed to. So go to the hospital, let them carry out the test. Like I told you, the test will be carried out in the lab. And I'm not a laboratory
person.
I don't work in the lab. So even if I work in the lab, I will just have to take that blood and do it. So how will I be using my eyes to judge? Please, to prevent any complications, I want to encourage all mothers, everyone, even grandmothers, that will say sit at home. Whether you give birth anywhere,
There's this agbo they always use in our
in
family.
maternity, in traditional birth attendance, please know that the second day, within 72 hours, let me take my baby to government hospital and check my baby's serum bilirubin level. Thank you.
Thank you so very much. We're gradually wrapping up the program for today, and we can't but thank you enough. Now let's look at the effects too, which is another side to this conversation. I'll give instances. For instance, you know, you go through this and then they say it is because of the injection they gave him. That's why his leg is swollen. They will tell you that because of chickenpox, that's why he has some body signs and all that. Looking at the process of jaundice, if treated, if it is the first type or the second type, are there any aftermath? Aftermath in the case of, that boy is looking bye-bye. His eyes is now dim because of the jaundice he had when he was a baby. Or the boy's his eyeball are so big because he had jaundice. What are some of the effects of jaundice to a baby, maybe when grown?
Thank you so much.
Yes, ma'am.
Like I said, you know, jaundice, you know, in a newborn, when a baby has a jaundice, most of the time, even in my department, we don't even write injections.
Okay.
We don't write injections at all. If there is no sepsis with baby, they just come to the ward with that thing that they will use to cover their face, and we'll put them under lights. Once you detect on time and you come to the hospital on time, in fact, it is less stress-free, even for us and for the mothers. But because all what we have to call you for is, your baby is crying, come and feed. Your baby is crying, come and feed. You continue to feed your baby till we discharge you. You don't have any problem. But in the case whereby somebody stayed at home, as in waited for a long time, and there are a lot of complications already, that's the one you are talking about. That's what I said, we call it sequelae, after effects of that jaundice. After effects. It's not of the treatment but of the jaundice, because maybe by that time the thing has affected the brain.
You just gave birth, don't worry, this thing with the baby is just a minor thing, don't go out yet, you can't go to the hospital. In fact, I know of some traditions, without mentioning names, where they will say a mother don't go out for 41 days. Is it 41 days or 31 days or something? They say don't go out, and because of that they keep the child at home. With the jaundice, it becomes very bad. What would your advice be, your parting words to mothers with a child living with jaundice, or mothers with newborn babies? What are the things they should start taking into cognizance and things they should avoid?
Thank you so much.
Yes,
like I said the other time, that all mothers should monitor and observe their babies. When you give birth to a baby, before you leave the hospital, please observe. After leaving the hospital, please observe your baby. And whenever you know or you realize anything that there is a deviation from normal, please come to the hospital. Go to the hospital. It does not cost you anything. There is something that does not cost you anything. Will you now delay and lose or mar what you have carried for 9 months? It does not. Please, let's go to the hospital. How much are you going to spend to take transportation to general hospital? How much will you run that test? To compare to that 9 months, to compare to the stress you have gone through in carrying the pregnancy and during the delivery. So I think It's not costing us anything. Once you observe, even if not jaundice, anything you observe on your baby, please go to the hospital. Don't sit with people that will say, jókòó síbẹ̀, let us sit down there, leave that baby, tomorrow we'll observe again, this will do this. Somebody will say, even mothers, please don't wait till daddy will be around and will say come and collect money. Please bring your baby. It's your baby, it's both of you. Because some people will say, my husband is not around. It's until he comes. He's coming 2 days later. He's going to come at the weekend. So you will now be waiting when the thing is going to the baby's brain. It's when baby now start moving anyhow that the relative will now say, let's follow you. It's not compulsory people follows you to the hospital. Please bring your baby whenever you noticed anything. So that babies will be treated on time. And you at least have the knowledge of what is going on. And you'll be able to go home safe and fine. And your baby will be brilliant. Your baby will be able to pass through the developmental milestone in a normal way. There will not be fear of, maybe by 3 months. They said by 3 months. Because doctors in Ikorodu will explain to you. When you come and there are a lot of complications, they will explain to you what you are likely to expect. So instead of being in fear, being like, what will happen? Please come on time. Let's take care of this baby. Let's manage this baby well. And I pray that God will protect all our babies for us in Jesus' name.
Amen. Amen. Amen in Jesus' name. Thank you so very much. Let's see if we can just chip in one call before we wrap up. Hello to you. Mr. Friday, morning to you this morning.
Well done for the program.
Thank you.
Yeah. We enjoy your guest today.
Thank you very much.
I want to ask, does that thing kills a baby as in this thing jaundice or what is it called?
Yes, jaundice.
Yeah. And how long can such stay with a little baby that will make the baby probably maybe will cut and stretch?
All right. Thank you, Mr. Friday. I want to believe that Mr. Friday joined us a little bit late, but let's take it back a little bit. He asked 2 in 1 questions. At what age or at what point does it become very bad? You've answered that. And at the same time, he also asked that, does it kill babies? Please help us attend to that.
Thank you. Like I said, that it kills baby when it is not treated early. When we allow it to degenerate to the level that baby has kernicterus. Kernicterus means that when it has affected the brain of the baby, when that bilirubin level has crossed and has entered the brain of the baby. So at times, when we now start to treat, some people will not still treat, some people will not still come to the hospital. Babies will just die at home. Some people by 7 days. When we in those days, they call a disease Makije. In those days, some babies will just die. Some babies, when they come these days, let's talk about now.
Yeah.
When they now come when it's already late, neonatal jaundice can kill. Because once it enters the brain and baby is not, maybe there is infection, there is sepsis again, and maybe there is prematurity, a lot of things, baby could die. But like he has, that how many time,
how many days will it take before the baby will pass?
Will die.
Yes.
It depends on I said that even everything about neonates, we all know that they are not mature. And this baby, they do not even have anything to fight infection or to fight. So it depends on the time that the baby could.
So it's the earlier the better.
Better for the treatment. Because the one I said I saw last week, I think the baby died before even 1 week. Because mother later came 5 days, when baby was 5 days, and maybe by 8th day or 9th day, baby died. So it depends on, and we're giving oxygen. We'll now be giving a lot of things that baby is not supposed to even go through. We have changed the blood. We gave oxygen. So many treatments. Infection is involved. We treated and everything, and still baby didn't survive it. So to prevent all this, that's why we are advocating for early treatment. Thank you
so very much. You've heard the voice of our guest today, Chief Nursing Officer from the Pediatric Department, General Hospital Ikorodu, having talked to us as regards the conversation on neonatal jaundice.